Hello everyone, I am Nurse Blessing Obialo, your favorite nurse, the safety nurse. So your health is my concern and I ensure I provide simplified health information for you to stay ahead on your health. So for this month we've been dealing with female health, carrying out a campaign talking about the woman's body and also different health conditions. Today is not going to be different. We're going to be talking about a health condition you must have heard about. Millions of women are passing through this health condition and most of them are very confused on what to do. Have you heard of PCOS? Yes, that's the health condition. Polycystic ovarian syndrome. I'm sure you've heard about it and you may be confused on what it means, on signs and symptoms, and how to handle it as a woman. So I'm going to be helping you today with simplified health information on how to handle this. Let's do it. So let's start by breaking down the word polycystic ovarian syndrome. Now, polycystic ovarian syndrome. So poly means many, cystic, filled sacs were on the ovarian syndrome. Syndrome is a collection of signs and symptoms. So when a woman has polycystic ovarian syndrome, you see a lot of symptoms coming together, different things, and both physical, both emotional, affecting her reproductive system, affecting her physical system. So it's a combination of different symptoms. So polycystic ovarian syndrome. So what happens when there's polycystic ovarian syndrome? Normally, as I said, the body should release an egg every month. But in the case of polycystic ovarian syndrome, the ovaries do not do this. Why? Because the woman is continuously producing excessive amounts of hormones she shouldn't produce excessively, and less of the hormones she should produce, which will help to aid ovulation. Ovulation is the production of the egg. Now, if you have issues understanding ovulation, you can check a video I created on ovulation. So what happens is that the body produces excessive hormones like insulin, yes, like testosterone, instead of producing good amounts of estrogen, which helps in ovulation. So when this happens, the woman is not able to ovulate or to produce, to release eggs during her ovulation. So this leads to a couple of symptoms. Now these symptoms, I said, are what come together to make the syndrome called polycystic ovarian syndrome. So a woman may begin to experience irregular menses. Notice that these symptoms may present collectively in a woman, or some women may just experience just some of these symptoms but not all together. It depends on the woman's body. So one, we start with irregular flows, or it can be excessive bleeding during periods, yes, or missed periods too. Number two, a woman may experience acne or oily skin. Number three, you may have hair on the face, on the chest, on the face, just excessive hair. Then also for some women may have pain, which sometimes feels like bloating, but pain at the region of the ovaries. So women may also have cysts on their ovaries. Now this can only be seen when a scan is done, but that's also one of the symptoms of polycystic ovarian syndrome. Now what does it lead to? It leads to difficulty in getting pregnant. Woman may go on to have miscarriages or not even conceive. So what's the cause of this? What is the root cause of polycystic ovarian syndrome? Now, doctors are not very clear on the cause of PCOS, but it can be very much related to two factors. We have genetic factors. Yes, that's family history. So if you have a family history of PCOS, there's a high probability that other people in the family may also have this same disease. Now, another main cause is hormone imbalance. We talked about insulin resistance, and we talked about when the body begins to produce excessive testosterone and less of estrogen. All these are imbalances. So all this predisposes a woman to having PCOS. But yes, hope is not lost. This is not for you to self-diagnose yourself. The best thing to do is to go to the hospital, and some couple of tests will be run, and scannings and other things to discover whether you're actually having PCOS. So what's the better way to manage PCOS? Because a percentage of women have been able to have their children irrespective of PCOS. So what are the ways to manage PCOS? So we have both lifestyle modification and we have medical ways of managing PCOS. Now, medical ways will be prescribed by your doctor, but lifestyle modifications are things you can easily do, I tell you. 1. Ensure you eat good food. Can you get rid of all this processed food, excessive sugar too? Yes. Make sure you balance your diet. Can you just feed mainly on natural foods and foods that will help your body to be able to deal with insulin resistance? So no more junks, but let's stick to natural foods. It's very helpful. Number 2, which may be prescribed by your doctor. If you're having insulin resistance, you may be given metformin or any other drug to help deal with insulin resistance. Number 3 is a lifestyle modification we can all do. More exercise. Now, exercising helps to deal with insulin resistance in that as you exercise, you are burning calories, and as you're burning calories too, you're making your body, you're helping to improve the glycemic index of your body. So exercising really helps. These 3 are very important points which will help to maintain your health even with PCOS. So many women are still able to have their children and conceive with PCOS after modifying their lifestyle. I hope this was helpful. Yes, PCOS can be so overwhelming, but just know you are not alone. I would love to help. You can drop your questions. If there are other things I can give clarity on, and remember to reach out to family and people who can support you through this journey. So if you loved this video, I would love you to like and subscribe, and also follow us. Subscribe to our YouTube channel, because we're going to be continuing different series on female health. Also, remember to share this video with someone who you know will need this information. Yes, share it with someone. Until I see you next time, I remain the safety nurse.